Your A1C is normal, so you're good, right? Maybe, but I want you to look at one more thing. First, A1C is basically a longer-term picture of what your blood sugar has been doing over the last few months. Your fasting glucose tells you what your blood sugar was around the time of that blood draw. A1C gives you a broader view over time. So, why should you care? Because blood sugar regulation matters long before somebody hands you a diabetes diagnosis. When blood sugar stays elevated over time, it can eventually progress to prediabetes and type 2 diabetes. And diabetes raises the risk of things like cardiovascular disease, kidney disease, nerve damage, and eye disease. So I don't want you waiting for a diagnosis before you become curious about the number. Here's what the numbers generally mean. An A1C below 5.7% is below the prediabetes range. From 5.7 to 6.4%, it's the prediabetes range. And 6.5% or higher is in the diabetes range. Although diagnosis usually needs to be confirmed in the appropriate clinical setting. But here's where I want you to stop treating your labs like a pass or fail test. Imagine your A1C was 5.1, then 5.3, then 5.5, and now it's 5.6. 5.6, you're still below the prediabetes cutoff. But did you notice the trend? That trend doesn't diagnose you with anything, but it gives you information and maybe a reason to ask why it's moving. And in midlife, that's worth paying attention to because sleep, activity, body composition, medications, and hormonal changes can all be part of the bigger metabolic picture. So pull up your previous labs and ask 3 things. Where am I now? Where was I before? And what direction am I going? Your labs aren't just numbers with little red flags next to them. They tell a story over time. I'm Trish Schneider, and this is Midlife Decoded. Follow if you want to understand your labs, ask better questions, and take a more informed role in your health.